Hi, good morning, everybody. My name is April Demito, and I'm going to be your instructor over the next 6 weeks of your clinical rotation in adult across the lifespan women. So, tomorrow is the big day. Tomorrow is standardized patient, and I thought that I would make this little video for you to discuss the expectations of tomorrow. First of all, you must be on time. During the exercise, you will see that in the sign-ups that there were 2 people for each slot. That's because one person is going to be the patient, one will be the provider, and then you'll switch. I have cases for each of you. So you should be familiar with common cases typically seen in the women's health population, like UTI, STI, pelvic pain. There aren't any pregnancy case studies, so I don't think you need to delve into that all that much. But make sure that you know about the common conditions in pregnancy. Incontinence is the one. Incontinence later in life with menopause. So you're going to perform an examination on your patient. You aren't going to actually do things like pap tests and so forth, but you would tell me. If I were in practice, I would do a pap test, and you would go through the steps if it were indicated. Now, if a patient is coming in for UTI, would you be doing a pap smear on them? No. So it wouldn't be indicated in that particular case for you to do a pap test on that patient. So you would also discuss the that you're going to do a urinalysis and all of that stuff. So if you have never done a standardized patient before, I can see that this would be kind of a scary experience for you. But imagine you go in, you introduce yourself to the patient, be professional, ensure that you have your lab coat and stethoscope with you, and you start as you would any examination. So when I go in, when I have a patient come in, I ask them first, how can we help you today? What brings you into the office today? And those first couple words that they say, that's your CC, your chief complaint. That's what brought them to the office. And then elaborate on that. You're going to ask them questions about the condition that they're there for. So know how to develop a history of present illness. Because after you're done with your examination, you're going to get 1 hour, and it will be timed, to write up a SOAP note. And you must have all components of that note. And you need to make sure you have a CC, an HPI, that you have all of the history. What is included in a history? You need to know what the medications are, what the allergies are. You need to know if they have any past medical conditions, surgical history. What's their immunization status? Do they have any family history? You need to know if they have any social history. Because this is a women's health rotation, they're also going to have another category of reproductive history. How many pregnancies? How many sexual partners? Have they ever had a sexually transmitted infection? Any miscarriages or abortions? Do they use any birth control? How many sexual partners in a lifetime? Are they monogamous? Are they heterosexual? Are they gay? So, you have to have an extra section in your women's health, which is reproductive health. Also, let's step back. In social history, I want to know do you smoke? Do you take any narcotics? Do you smoke marijuana? Alcohol? Do you exercise? What do you do for a living? All of those things are important keys in the social history, and I expect those too. Then you're going to go to the review of systems. Now, in the review of systems, this is going to go over every body section in that there is. Or you can simplify it and say all body systems negative except those stated in the HPI. That will be acceptable. That encompasses your S portion of the SOAP note. That is subjective. Subjective is what the patient tells you. Now we're going to move on to the objective section. The objective section is what you see. You always start out with vital signs, and then you're going to go through every body system and let me know what the positives and negatives are through every body system. That is your objective section. Next, you're going to go on the assessment. Your assessment section is going to be your differential diagnoses. So, what is the patient there for? You need to come up with a minimum of 3 to 5 differential diagnoses with ICD-10 codes attached. So that's a minimum. You also need to come up with rationale as to why you have chosen those. You can't just say urinary tract infection, ovarian cyst, retrocele. You have to tell me what helped you come to the conclusion that that might be one of the possible diagnoses. Next is the plan. In the plan, you announce what diagnoses you have chosen and then how are you going to treat it. Urinary tract infection. Also, in the assessment section, you're going to have, or in the plan, you're going to write urine culture, urine dipstick UA, and then you're going to write what the lab results are, and you're going to write what the treatment is. Cipro, 500 milligrams every 12 hours times 5 days. And if there's any follow-up, and you're going to educate the patient. Patient is educated to make sure she urinates following intercourse, that she wipes from front to back, that she does not hold her urine, and that she drinks and increases her fluid intake. So that's what your SOAP note is going to encompass. And all of those things need to be present, or else you are going to have to come in on Thursday and redo your whole thing. And that's the unfortunate thing, because even if you do your examination spot on and you miss the review of systems in your SOAP note, you have to come in and be remediated. And I really hate coming in an extra day. And I know you hate coming in to do an extra day. So let's make sure you get it right the first time. It's timed. You have a limited amount of time to do it. So be prepared and know what you have to do to get it done. Bring your computers with you tomorrow so that you can get that done timely. All right? So that pretty much describes tomorrow. So let's go over what the expectations of the coursework are. Now, I have, I pretty much put everything in the content section. You have your syllabus, and this is a video that I made for last term, but you may find it helpful, and a calendar. I have the calendar here to go over when due dates are. Because there are a lot of assignments in this coursework. So make sure that you turn everything in on time. And I am going to create drop boxes for you to submit your assignments in. So I'm going to do that probably today, because I think it's just easier to have a Dropbox to submit it in than to email it to me, because I have to tell you, I get bombarded with emails and it can get lost. So I'm going to try and do it that way. Also, Typhon. You must report in Typhon every Sunday. Every Sunday, I look at your Typhon report. You have to keep track of every patient that you've seen that week. If you did not go to clinical that week, you still have to report. You would put 0 for patients, and you would do your clinical summary and say no clinical this week. You must keep up with it. If you do not keep up with it, you will be docked points. Last term, I had not taught this before, and so I kind of got, I didn't realize I had to keep track of the patients, and there was one student that did not track any patients until the last week of clinical. That will not happen this time. You will not be allowed to move forward if you do not stay current with your patients. I have posted some videos here that I found that I think you may find helpful as a refresher. It would be a good idea for you to watch those in preparation of your standardized patient tomorrow. Also, it's imperative that you keep a clinical reference book with you at all times. If this is your first clinical, you're going to start it now. And this is something that you should have been preparing for your whole time. You'll use this as a clinical reference when you graduate and then move on. Everyone needs to do a case study. And you need to complete your clinical calendar so I can have an idea of where you're going to be. This is an example of your weekly summation, and the weekly summation is a continuum. So this is a document that you will not make a new one. You will continue to elaborate on this on a weekly basis, and you submit this to Typhon. Everyone must do a research paper. Here is some information on standardized patient. I would expect you would look at this. History and physical rubric. You are going to be expected to do a history and physical on one of your patients in clinical. You also will be submitting SOAP notes. The professionalism contract must be signed and given to me prior to the standardized patient exercise, or you will not be allowed to move forward. Evaluations. Make sure that you have your preceptors do the evaluations. If you have 2 preceptors, you must do a midterm evaluation at 4 weeks, then a final at 8, and you will need to do that with both patients. NCLEX assignment. On a weekly basis, you are required to do some of the Fitzgerald examinations. I'm going to create a Dropbox for you to submit to. This is a good exercise. I think that you can learn a lot by taking these examinations, so do your best. All right. And so I think that pretty much sums things up. I look forward to meeting you all tomorrow. Remember, we're in the Monsanto building. And I think that you definitely have enough resources to ensure that you will be able to pass this well. But do keep in mind, I'm very strict on the note requirement. And that's not just me. This is a requirement of Northern Illinois University. If you miss any components of that SOAP note, you leave out the review of systems, you leave out the differential diagnoses, you will not pass and you will need to remediate it on Thursday morning. So, good luck!